I'm about to start studying medicine at the University of Manchester. How will the parties ensure I can graduate into a fully functioning NHS?
Thank you, Ishani. So just about to start studying medicine at Manchester University. Daisy Cooper.
Well, first of all, really good luck. I hope it goes incredibly well. We need lots of people signing up and studying to become the medics and our NHS staff of the future. Look, under the Conservatives, our health and social care services have been driven into the ground.
Health is, of course, a devolved issue, devolved to the UK nation. Stephen Flynn, your party's in charge of health in Scotland. It is a time of record waits. How would you ensure that Ishani graduates into a fully functioning NHS?
Yes, well, Ishani, good luck. To start with, as someone who was under the care of the NHS from the age of 14 to 32, because I was a disabled man, and I physically wouldn't be standing here today but wasn't for the wonderful treatment that I received from the NHS. I know what it is to live in chronic pain, and I know what it is to have that chronic pain removed, and it's only thanks to the NHS that happened, which is why in Scotland we don't just have record funding, we don't just have the best paid nursing staff, we don't have a single NHS strike in Scotland, and of course we do have some of the best performing NHS levels in Scotland as well. But given that you're going to university to study medicine, I think it's also important to remind everyone in this audience the difference between the SNP and the Westminster parties, because in SNP-controlled Scotland, you wouldn't pay a single penny in tuition fees for your studies. What a difference that would make to your education and your future.
You do accept that you have record waits for treatment?
Indeed, nobody would seek to dismiss the challenges which exist in our NHS right across these aisles, primarily driven through two issues. One, the backlog from COVID, but secondly, the austerity agenda which is impacting us from Westminster and has done over the course of the last 14 years. And there's £18 billion of cuts coming down the line, agreed to by Angela Rayner and Penny Mordaunt. The Tories and the Labour both know that they're going to cut public sector investment to come, and that's going to have dramatic consequences on the NHS in the devolved nations, because as Wes Streeting himself said, when it comes to NHS waiting times, all roads lead back to Westminster. It's why the cuts that are coming down the line aren't acceptable, and it's why the Labour Party need to change their stance.
Angela Rayner, cuts coming down the line?
Well, that's not true, because we've said that we'd end the non-dom loophole.
Are you disagreeing with the IFS, Angela?
We would end the non-dom loophole so that we can bring that money in and have 40,000 new appointments every week.
But you're familiar with what Stephen is referring to. The IFS saying that both of your parties are not being honest because of the promises that you've made to bring debt down.
Non-dom is not going to close the £18 billion fiscal gap which the Institute for Fiscal Studies says exists. There is a conspiracy of silence between the Labour Party and the Conservative Party in relation to this. You need to explain to the public how you are going to close that gap without making NHS services worse.
We have been very clear that we're going to look at efficiencies as well, so we can have technologies.
£18 billion
we would
of
have
efficiencies, Angela,
technology, the record number of waiting lists in the country now, and all roads lead to the Tories and what they've done to our public services.
And how is your fiscal plan different?
Let's get